Our title is a good one, Holding Up More Than Half the Skies, Women and Girls During COVID. It's a well-known phrase that women hold up half the sky, but I think women hold up more than half the sky. And what we're finding in the midst of COVID and the strain on all of our systems is exactly that. I want to thank the Global Health Council and the What to Expect project for putting together today's event. I'm the CEO at Pathfinder, and I'm really delighted to be here with a number of my colleagues, our country directors in Burundi, in Ethiopia, in Nigeria, and you're going to hear from our country director, Riaz Mubarak Lee from Mozambique, and our colleague Reshma Trasi at Pathfinder today. As I was thinking about this meeting, I was reflecting on a number of things. The first is the courageous work that my colleagues at Pathfinder and so many of you and our colleagues have done during the course of the pandemic to fill the gaps that have emerged, unexpected, predicted, and unpredictable. And I also thought back on my time when I served in the Obama administration as the leader of the Global Health Initiative, working with Secretary Clinton and the leaders at CDC and USAID on seeking to build more integrated, systematic responses in global health. What stood out for us then was the effect that lack of systems, lack of integrated systems, lack of resilient systems had on women. And we saw that so clearly in the number of women who died needlessly on a day that should have been a day of great joy, the day of giving birth to their child, the day that so often is the most dangerous day in their life. And so as I was thinking about today, two things really struck me. The first is that women and girls pay a big price when systems break down, when systems aren't resilient. And women and girls need, in coming out of this pandemic, more resilient systems. We've seen the price women and girls pay today. Girls leaving education with little sign that they will return. Women dying in labor and delivery because the most basic care is not available because it's been shifted to COVID-related services. Domestic or gender-based violence because of the pressures of the system around and the inability to get to safety. And the economic cost of so many women losing their jobs or losing their livelihoods. So when the system breaks down, women and girls pay the biggest price, and that's what we've seen today in the pandemic. What also stands out for me is that we can't have resilient systems without women playing a leadership role. Women are resilient. Women are innovative. And to develop a resilient healthcare system means that we need to honor and support the role that women play as frontline health workers. When an illness breaks out due to pandemic or otherwise, it isn't a Ministry of Health or a hospital or anybody else who hears the first sign of that illness. It's almost always a woman, a mother, a grandmother, an aunt, who hears the first sign that something's not right, and then has to make all the decisions around that to care for the person, to separate someone who's sick from other members of the household to protect them, to get help at a hospital or a clinic or in some other way. So supporting women as frontline health workers, honoring this role, giving them the tools, helping integrate them into the healthcare system is required to build a more resilient system. And we know, of course, that most community health workers are also women, and that women work across the healthcare system as a whole. We also need women's innovation. We need the resilient role that women play in helping their communities to be given a larger voice in the design and operation of healthcare and other fundamental systems. The pandemic shows us that, and it shows us that we can't build better and more integrated systems without women's leadership. So women and girls are holding up more than half the sky, and let's use this opportunity to build on their resilience and innovation to stronger systems. Now, that's a challenge because we know right now there are an awful lot of priorities. And where do we start? And I'm pleased, therefore, to have with me a dear friend and colleague. We've had the chance to work together in Burkina Faso and elsewhere, Benoit Kalasa from the UNFPA. And Benoit, if I can just turn things over to you, one of the things I think I've learned in my work with you is you're very strong at thinking about, amongst all the things that need to happen in a situation, what are the biggest priorities and what do we do now? And in the face of this pandemic, I'd just like to hear you reflect on that.
Thank you very much, Lois, and good morning, colleagues. I'm very happy and honored to join this conversation today, not only because of my love for Pathfinder International, but for the work you do and the leadership, the commitment that I have discovered in your president. As Lois said, we have worked together. We share same passion and commitment to the empowerment of girls and women, especially in Africa. Lois, I do like your introduction. I'm here actually by default because my executive director asked me to represent, but this was, I think, a gift for me and making my day, my Friday. So thank you for joining this conversation. So what I intend to do in the coming few minutes is just to present our UNFPA, the United Nations Population Fund, which is also the United Nations Sexual and Reproductive Health Agencies, has responded to the pandemic. We've really focused on girls and women and the most vulnerable, not forgetting old people. And in doing so, we have been guided by the principles of the International Conference on Population and Development, and also by solid and innovative population data dashboards. Let me just start by some figures that, some estimates that we have done in partnership with Johns Hopkins University, Victoria University in Australia, and Avenue Health. We found that inaccessibility of quality SRF services carry devastating social, economic, and public health consequences. And we found that more than 47 million women could be lose access to contraceptives, leading to 7 million unintended pregnancies if we just stay within 6 months of lockdown. We also found that every 3 months of lockdown leads to an additional 15 million of women who could be affected by violence. We also found that 2 million female genital mutilation cases could occur over the next decades, but we could avoid that if there was no the consequences of the pandemic. And finally, just to limit the fact in relation to the girls, this also has an impact on child marriage. We found that 13 million child marriage will take place if this situation continue, because schools are closed and then girls are not. So when we look at these figures, we say, what do we do as an organization? How do we carry on our normal programming? And how do we scale up our programming? How do we reinvent the partnerships? And how do we also, just to reflect on what your introduction, how do we make sure that women and young people, organizations are parts of the solution? So the principles for us are UNFPA is committed to invest and support women and girls as recommended by the ICPD Plan of Action. And this is within the Agenda 2030, which recommends us not to leave no one behind. And the only way is that if you know, yesterday, the co-chair of the Bill and Melinda Gates Foundation was saying that within this pandemic, we have discovered a shadow pandemic. That is the impact of COVID on girls and women. So we know that investment that empower a girl can triple a lifetime income, can increase a nation's economic growth and lead to a cycle of healthier, better educated children and young people. This is having resilient individuals. So before going to the resilience of a health system or community, we need the people themselves to be resilient. So we do that by empowering them through education. It starts by there, and then by economic opportunities. And critically, what we are looking at here is that we look at the investments that are critical to attain universal access to sexual and reproductive health and rights. And as UNFPA, we have worked with other partners and the United Nations Organization, Global Health Organization, to define within UHC, Universal Health Coverage, the centrality of SRHR. So that's what we think that we should be doing. And in UNFPA, this is part of our strategic plan. As you know, some of you know, in UNFPA, we have defined 3 transformative results. One is ending preventable maternal death. The second is ending preventable, ending a met need for family planning. And the third one is ending gender-based violence and harmful practices. And these are not only transformative, but they are integrated and interactive. So I think guided by the principle of the ICPD and these 3 transformative goals, we continue working with countries to make sure that the world's young people realize their rights to SRHR, quality education, which include also comprehensive sexuality education and employment opportunities. And one example is that in West Africa, we have started the Sahel Women Economic Empowerment and Demographic Dividend program with the World Bank, which now is being expanded to beyond the Sahel now. I think we started with 6 countries. Now with the World Bank, they want to extend this to 25 countries within the Human Capital Project. This is part of building resilient now nations through health systems. So as UNFPA, now the response, what have we done? I think when the pandemic came, we focused on 3 main areas. One is, how do we ensure continuity of sexual and reproductive health services? 2 is, how do we address the emerging increase in gender-based violence? And the third was to ensure the supply of modern contraceptive and reproductive health commodities. So we frame and then we focus, we repurpose all our interventions around that. And we did that not only as UNFPA, but within the general United Nations global response. So we have reached already over 5 million women and 1.3 million adolescents and young people with SRHR services. We have procured services and supplies such as PPE, contraceptive, reproductive health kits, and dignity kits in over 107 countries affected by the pandemic. So our country level work is framed around national priorities because we always align with the plans as defined in countries. So we continue doing this, and I know that we have time to have a further conversation. What we have done to support this is to work on developing a population vulnerability dashboard. What is it? This is a tool that we designed to provide policymakers, partners, and the public access to useful information on population vulnerabilities to COVID. This dashboard includes information on age, sex, isolation, residential density, and access to water. So in the geo-reference maps for more than 200 countries, so we could see the differences and see where are the pockets of vulnerability so that the responses could be targeted. And this also showing access to health services. So I think to cut short and to conclude, COVID-19 put the world in turmoil. And despite our best efforts, we know that in many places, progress that we reach has been slow and even reverse. Going forward, our efforts will be recovery and supporting countries to build back better, which we hope will lead to more equal, inclusive, and resilient sustainable economies and societies. And we have an incredible opportunity to build on the innovations, as you mentioned, and solutions that have been found to keep access to SRHR services, including family planning and contraceptive choices available during the lockdown, such as self-care, the telehealth, and innovative supply solutions. We have looked to build a better future. We can only do so through expanded partnership with donors, national and local government, the private sector, and civil society, but most especially young people, women organizations, and building an intergenerational solution, solidarity and support. So let me pause here, Lois, and thank you again for inviting UNFPA to join this conversation, and for me to see many friends from Burundi, Ethiopia, East Africa countries where I've worked, I think, for almost 15 years, and looking forward to participate in the conversation. Thank you again.
Well, thank you, Benoit. And I'll just ask one very brief follow-up question before turning it over to our panel. Our organizations share the recognition that sexual and reproductive health and rights are the foundation for a healthcare system, that they're the foundation for the empowerment of women and girls, that these services are a foundation for a resilient society. And you shared some pretty challenging statistics about how quickly the pandemic has set us back. I want to ask if you could just very briefly share what gives you hope that we can make good progress going forward, not only getting back to where we were, but moving ahead in pursuit of the SDGs and our common goals.
That is actually the question of the future that you're asking me.
Yeah.
I believe that once we succeeded in convincing national responses plan to recognize the centrality of SRHR and addressing GBV as part of the response is already one, I think, one solution to the future. Keeping the focus, what we are doing today here, keeping the focus on girls and women. Of course, it is human-centered design or program, but here we can say, okay, girls and women-centered design or program, so that we can move the integration of SRHR within primary health care and then within UHC, and making sure that any intervention is supported by strong data disaggregated so that we can show the pockets. We can bring evidence how women and girls are impacted so that they are no more a shadow pandemic. They are really the pandemic within the pandemic and recognized as such. And lastly, of course, it is beyond our role as Pathfinder, international role as UNFPA. I think unless we ensure that when the vaccine is available, it should be accessible to all and timely accessible. So these are just some reflection that I think that should be considered as priority going forward. Thank you again, Lois.
Oh, thank you so much, Benoit. Well, thank you. And I'm going to turn it over to Reshma Trasi, my Pathfinder colleague, who will pull together our panel.
Thank you, Lois. And thank you, Benoit. I mean, really great words, not just looking back, but also looking forward in terms of the task ahead of all of us. I want to start with, again, just reiterating what Lois started off with. Really, women and girls really do hold up half the sky, right? And it's not only half the sky, they also hold together the social fabric, not only in our communities, but also of our health and social systems. They are frontline health workers. They are, like Lois said, the caregivers in the household and the communities. They are the activists on the streets. They are the advocates at the decision-making table. And might I cheekily add, in countries where COVID-19 is under control, women are also heads of state. And yet, for reasons that we know all too well, women and girls have been adversely affected by the COVID-19 pandemic. It's worth noting again that not only have women been affected and girls are experiencing this dual epidemic of health and economic disruption that we've seen all around the world, but they are, like has already been said, they're at higher risk of gender-based violence because of lockdowns and reduced mobility, unintended pregnancies, reduced access to essential services, unsafe abortions at rates far higher than we've seen before. We really are at risk of reversing the progress we have made. You heard some of the statistics from Dr. Kalasa of what we're up against. A recent report by the Guttmacher Institute cautioned that even a 10% proportional decline in modern contraceptive methods in low and middle income countries would result in an additional 15 million unintended pregnancies in the course of just 1 year. A decline of 10% in coverage of pregnancy-related and newborn health care would mean an additional 28,000 maternal deaths and 168,000 newborn deaths. Today, I am here with a diverse and illustrious panel of speakers, not only from the public sector and civil society, but the private sector as well, to talk about what we are doing, what more we can be doing, so that these horrific numbers and figures do not become our dystopian reality. My name is Reshma Trasi. I am the project director of Resolve at Pathfinder International. At Resolve, we combine consumer insights, behavioral economics, design thinking, and public health to design and test innovative behavioral data-driven products and services in Bangladesh, Burkina Faso, and Ethiopia. We are exactly what Benoit said. We are a women and girls centered program where we focus on those women and girls who say they want to use a contraceptive method, but are not able to follow through on their intention. And the products and services we are designing and testing at Pathfinder are helping them to follow through on that intention and actually use contraceptive methods. I also have the pleasure and privilege of being your moderator today. So first, some reminders. Please, we want to hear your questions. So please use the chat window at any point to ask your questions. If you are on social media and would like to share your thoughts on anything this panel is discussing, I think we will be sharing the social media handles in the chat window as well. So without further ado, let's get to know our panel a little. I'm going to start with Toro. Ms. Toro is currently the President and Executive Director of the What to Expect project, Prior to being appointed to her current role, Ms. Toro worked at the US Pharmacopeal Convention, leading the international regulatory policy and advocacy work. So Annie brings a great combination of not only having worked at the policy level, but through her current work, really working at the community as well as the structural level as well. Annie, question for you. The What to Expect project, I know, is doing some really fascinating work around the world. Can you share, like some of what Benoit was talking about, one or two ways in which your work in reaching women and girls has been affected by COVID-19?
Thank you. And thank you, Reshma, for bringing us here. I wanted to say a special thanks to Pathfinder International and Crystal Lander for actually conceiving, and I want to say pun intended in saying that, this webinar, and for bringing us together. It's really, the timing couldn't be more timely and important. I appreciate Lois' remarks, as well as UNFPA. Just, we've collaborated together so many times, and it's always a joy to be able to bring together our perspective in conjunction with such a wonderful group of experts and colleagues. You know, for us, I have to say it's been pretty drastic, and I know it's been for many other people in organizations, most organizations. We just have to reinvent the way that we've just do our business, and it's never now business as usual. And I'll go through a couple of things real quickly, from antenatal checkups, obstetric care, postnatal care, essential newborn care, immunizations, wellness checks for children, sexual and reproductive health, including contraception, a big one, treatment for infectious chronic diseases, and nutrition programs have been suspended or limited. Maternal hospitalizations, you know, as we see in some of the programs that we do in the US, post-delivery have been truncated to as little as 24 hours, if at all, limiting an opportunity for staff-supported labor, recovery, breastfeeding support, education, infant care, and all these other things that are so important, including postpartum mental health management, increased number of maternal health disorders. This has been significant that we've seen in our community, and people coming, because we work with moms directly, they come directly with us in a safe and not feeling that they're not going to be judged by being able to speak their truth. Postpartum depression rates, postpartum anxiety, even postpartum psychosis, and overstretched services or not available at all. Services, lack of access to health services from healthcare facilities without staff COVID. Many of them, we're dealing with maternity deserts. And some of them, even the health workers, one or two have gotten COVID, so then they just shut down altogether. The uncertainty has led to fears of putting their child's health at risk to go to a clinic or health facility. Undermining the seriousness of symptoms has also been a big one, waiting a lot before reaching out to someone for help, which puts women's health in jeopardy. The increased number that Lois and our colleague from UNFPA raised on the increasing numbers of intimate partner violence cases due to isolation. Pregnant women are most vulnerable. Pregnant women are the most vulnerable of all. Stay-at-home orders limit women's ability to be able to find that space and safe space to avoid volatile moments with partners, and increasing exposure to violence. And, you know, we have to talk about issues of systemic racism that have resurfaced more than ever during this pandemic. Continuum care has been interrupted, which is a really critical part of the work we do, inability to guide moms for preconception through all the way throughout the postpartum period and longer. And all of that has been impacted. And of course, you know, there are a lot of women who have been increasingly more scared because they're having symptoms that they're confusing with typical second or third trimester symptoms, being abdominal pain, diarrhea, or many other things. And so that's been a huge issue that has taken us, you know, and that's as it relates to the work we do directly. Some of our programs have been completely shattered. We have to start from scratch to be able to deliver services to and do trainings to health workers on the ground who deliver these services directly. And we've had to stop that, but now we're starting to do all those trainings virtually. So fortunately, we're getting there. So that's those are some of the major issues.
I mean, a really sobering picture, Annie. I mean, not just, I think, the health disruptions that we've been talking about, but, the mental health disruptions that I think we discount all too quickly that caregivers are facing, and the lack of social interaction, which is something I think women and girls we count on in our social systems. I want to move the focus a little bit to Uganda. I'd like to welcome Dr. Robert Mutumba, who is the Principal Medical Officer in the Reproductive Health Division at the Ugandan Ministry of Health. In this role, Dr. Mutumba works across several critical areas and technical working groups that we're actually talking about today. These include maternal and child health, adolescent and school health in an environment where the lockdown has meant schools have closed, and the integration of programs across sexual reproductive health, HIV, and gender-based violence. Robert, the same question to you. Can you tell us one or two ways in which your work at the ministry in Uganda in reaching women and girls has been affected by COVID-19?
Thank you so much, Reshma and team. Morning, evening, good afternoon. So for Uganda, we've really had a significant impact from COVID-19, especially regarding the reproductive, maternal, newborn, child, and adolescent health services. So particularly, we registered a drastic decline in a proportion of mothers who are attending neonatal care services, but also those who are delivering from health facilities. And this was more marked in the month of April when we really had our first lockdown, where we had very strict measures as directives from the president. For example, in here, a mother could not readily access a health facility. For example, the most commonly available means of transport is a motorcycle, what we locally term here as a boda. So you find that it was no one actually was allowed to jump on a bike and be able to access healthcare services. So around this time, definitely we really registered a significant number of maternal deaths. But of course, we have challenges of reporting maternal deaths, especially at the community level. Then looking at proportion of mothers delivering from health facilities, we also see that because health workers also could not readily access these facilities, it was also a challenge for most of the mothers who would also get to the facilities to promptly receive obstetric and newborn care services. But also the other significant impact is the issue of violence against women and girls. The Uganda Police Force reported the highest number of cases of violence against women. And particularly, this was a time when men, majority of the men who are not used to keeping at home all the time, I think now this time around when they got locked at their homes, I think many men could really not catch up and tolerate most of the issues at home, and everyone was wondering why, we expected that maybe people had an opportunity to spend time with their families, but surprisingly, this is the time when we had a very high number of cases of violence against women, but also the issue of teenage pregnancies. So throughout this period, we've had a very alarming increases in the proportion of teenage pregnancies within the country. But the government has taken on a number of interventions, and we really want to, first of all, appreciate the involvement of the leadership of the country, right from His Excellency the President, the Office of the Prime Minister, the Ministry of Health, but also the other ministries, Ministry of Gender. So we've really had the senior top leadership very much involved, and through a number of forums established, like we had a national task force, but also each of the ministries and also at this sub-national levels, at the districts, we had all these task forces put in place to ensure that we also focus on continuity of essential healthcare services. Previously, we had a number of pillars, but particularly maybe of interest is the ministry established a pillar on continuity of essential health services. So this was chaired by the Director Curative Services. And through this, guidelines were actually developed to ensure continuity of essential healthcare services during this pandemic period. In addition to the guidelines on management of pregnant, lactating mothers, newborns, but also adolescent healthcare services. So,
Robert, I think this the issue of adolescent pregnancies and GBV, I really want to hold off on that, because I think Uganda has a very unique perspective and some of the leadership that the ministry has shown. So if I could ask you to hold on to that, I do want to come back to that, because I think you're pointing out to all of us, the unique vulnerabilities of women in the middle of, lockdowns and economic disruption as well. So I'm going to ask you to hold on to that, and I'm going to introduce with pleasure Dr. Joan Benson. Dr. Joan Benson is the Executive Director for Public Health Partnerships at Merck. Dr. Benson leads Merck's strategic engagement with global public health organizations involved in vaccine policies, immunization programs, and funding for vaccines internationally. So she's worked with the World Health Organization, Gavi, UNICEF, and the Bill and Melinda Gates Foundation. She is responsible for establishing and leading key strategic partnerships and programs to address vaccine-preventable diseases globally. Joan, the same question to you. How has your work at Merck been affected?
Thank you, first of all, and I want to thank the organizers for inviting me to participate in this conference. And I would say good morning, good afternoon, good evening, wherever you are. I think, first of all, no doubt the COVID-19 pandemic has touched the lives of many people, including people that I know personally. So I want to seize this opportunity to say that my heart goes out to those who have lost loved ones and those who are still coping with this disease or illness. I wish you speedy recovery. This pandemic has resulted in unprecedented disruptions to routine immunization programs all over the world, impacting decades of progress to expand vaccines coverage rates and to help protect people across all stages of life. And clearly, HPV vaccination is not exempt. The company that I work for, Merck, also known as MSD outside the United States, is a manufacturer of HPV vaccines. The WHO recommended, during this pandemic, that where health system capacity is intact and essential health services are operational, that fixed site vaccination services and vaccine preventable disease surveillance should be implemented. However, the reality is that countries are experiencing significant challenges doing so. We've seen logistical constraints in terms of getting supply of vaccines from point A to point B. We are seeing a decreased demand for vaccination services, including for HPV vaccines, due to fear of contracting COVID-19 in clinics, and also as a practical result of a lockdown. So with these disruption of services, even for short periods of time, there are clearly significant concerns about catching up women and girls who may have missed vaccination during this time. And although we're talking about women and girls, the same is true for routine immunization of children. We are also just seeing declining trust in government, science, and public health at large, as conspiracy theories playing out in social media. Many of you who read you are on these social media platforms, so you can see what's playing out there. So one cannot rule a spillover effect of these kinds of conspiracy theories on HPV vaccines. I can't rule out that effect. already fragile health systems are even further constrained due in part to reallocation of funding from vaccination programs to the COVID response. And clearly, we cannot, neglect to recognize that there are competing public health priorities, as well as a diversion of medical personnel and resources, much needed resources, including PPEs, personal protective equipment, to fight this disease. So these are just some of the issues that we're having to deal with as manufacturers. And this is why it's critically important that we continue to work with stakeholders at all levels to ensure that vaccination programs are maintained and strengthened so that they are resilient and sustainable. I mean, that's important, that they are sustainable even in the midst of the crisis. And that's why I love the remarks from Lois at the beginning when she said, and I wrote this down, that we can't have resilient systems without women playing a critical role. So for me, these are some of the things that we as manufacturers are having to deal with. And I'm sure some of you, if not all of you, in your respective, areas of work are having to deal with these issues as well. Thank you.
Thank you, Joan. And, I think one of the key elements of that, of resilience, is sustainability. So I think I have next the pleasure of introducing Dr. Michael Heerde, who is the Director for Sustainability. It's in his title, Family Planning at Bayer AG. Dr. Heerde has extensive experience along the value chain of the pharmaceutical industry, and this includes everything from marketing, regulatory affairs, commercial and business development, acquisitions, and licensing. In his role, he supports Bayer's engagement towards the Sustainable Development Goals with flagship programs in family planning that I know he's going to talk about a little bit later. Michael, the same question to you.
Yeah, thank you, Reshma. I hope the sound is okay now.
It's great.
Yeah, good, thank you. Thanks for having me here, and thanks to invite actually two representatives here of the commercial sector. I personally believe that is very much needed if we speak about systems, if we speak about time of crisis, that we go closer together. Health for all, hunger for none is the guiding corporate vision of Bayer. That means contributing to sustainable development is a core element of our company's strategy. Now, how COVID affected the work reaching women and girls. Last year, when nobody thought about COVID, at the Nairobi conference, Bayer was making a commitment at the UNFPA conference there, speaking about to provide access to family planning for at least 100 million women by 2030. In my work, I have the privilege not only to support the supply of contraceptives, but also to work with partners in capacity building projects in urban slums, in rural areas, as well as in humanitarian settings. I can speak about that more in detail later, which is, in my view, equally important as supply is. And Benoit mentioned the importance of resilient systems and strengthening system building capacities. How, and in this respect, maybe I should say, as a commercial company with the expertise we have in behavior changes, which is called in our language marketing, in regulatory affairs, in patient safety, in supply chain efficiency, we can bring much more to the table than just products. We can share expertise and bring in knowledge, and that is why we want to engage, or why we are engaging us in capacity building. So what was the effect? And I want to bring a positive effect of COVID in here to light a little bit in this dark environment of pressure on the crisis. I think the true recognition of partnerships in the family planning area between commercial and public has increased. So partners we spoke to a year back about projects I just mentioned, these talks accelerated from both sides, more goodwill, from both sides, more open mind, from both sides, more listening. And I think, you know, this is doors opened, mind opened, and both sides can contribute into this project. For me, that was or is still fascinating to see. This crisis is an opportunity. With all the bad news we have, we should also look at the bright side of getting closer together here. Maybe one comment on the supply, since we are not only a capacity builder, but also a supplier in the whole range of family planning products. We had now recently, actually in Germany, the numbers of COVID infections are increasing. Our operations continue to be in an alert mode. We are following strict procedures to safeguard the health of our employees, and we continue the operation in our plants. We have not been affected in family planning supply in the first wave of the COVID crisis. We had no serious supply chain interruptions, and we hope this remains going on. So looking forward to a great discussion today. Thanks for having me.
That's amazing. And I think both, a reminder of never letting a good crisis go to waste, as we say, finding those opportunities. I think we are going to be looking at doing things a little bit differently. And I completely agree, Michael, just the importance of every sector needing to work together and push together in the same direction. Finally, I have the pleasure of introducing my colleague and friend, Dr. Riaz Mubarak Ali, who is Mozambique's country director at Pathfinder International. Dr. Mubarak Ali has worked not only at the national level, but at the provincial and the district level with a specific focus on sexual and reproductive health, maternal health, and newborn health, and HIV and AIDS. Riaz, same question to you. Can you tell us one or two ways in which Pathfinder's programs in Mozambique have been affected by COVID-19?
Hi, Reshma. Good morning, good afternoon, everyone. Thank you for the opportunity, and Reshma, and organizers for really inviting us to have this opportunity to share the experience that we have in working in the current scenario that COVID-19 pandemic is hitting all of us. Just to say that in Mozambique, it hit by end of March. We are reaching now over 10,000 infections, and we have had already 73 deaths. So definitely COVID-19 has impacted our work. We work closely with the Ministry of Health in Mozambique, supporting advancing sexual reproductive health and rights services. And I would say that this has impacted in two dimensions. One is at the community or individual level. First, one of the aspects that we immediately started to see was the fear. Everyone getting scared, anxious on the infection rates that were being announced globally, the deaths, and how that was going to impact everyone. The second was around individual and community dimension, was the myths and misconceptions. And I think that's all what triggered as well what we have through WHO, the Mythbusters. But in Mozambique, we also were seeing those and trying to capture was around that COVID doesn't exist in some of the places, but in others also having the fact that we should not go to the health facility to get services because health facility is where we get COVID. So those type of myths also were kind of pushing back all the accessibility for services. The other aspect that is important to note at the individual, all this jointly led definitely for the slowing down and the descent on services accessibility during the second quarter of 2020. And with that, I'm talking about contraception services, immunization services that was also mentioned earlier, because those preventative services were the most affected. Deliveries were not that much affected, for example. So, and then definitely on addition to that, at the community level, the fact that in April, Mozambique had the level 3 emergency state declared, that led to closing of schools. And by closing the schools, the secondary level and higher levels, it halted the opportunity to access adolescent and youth through youth corners, through mobile brigades or outreach team that were going close to schools, providing contraceptive services, information, education around sexuality, and prevention for HIV and other diseases as well. So that has impacted severely that access. So on the other dimension, briefly just saying that definitely all these impacted the service provision or the system-wise. One, as generally we can say, it has impacted the unavailability of PPE equipment. That was not an exception for Mozambique. The other was also the providers were having fear to really become sick through the exposure, because the number of patients that we have per facilities are really high. And then the fact of starting with a rotational schedule at some of the health facilities to reduce the saturation of health providers in the same room and the facility also somehow burned out the providers that were working at the facility level. And then lastly, as the bridge part of both service provision and community or individual level, I would say the community level service delivery were halted for at least 2 months. And this has an impact when you consider that in average in Mozambique, we have around 12 to 15 kilometers that everyone has to walk to reach to the health facility. So that was also impacting the access, a part of the all other aspects that we could say that has impacted. And just lastly, as everyone was talking about the gender issue, in here, the voice and agency became somehow impacted when we talk about the restriction of people's circulation within the cities because of the level 3 emergency. So in those areas where we didn't have that enough empowerment, and if a woman or girl is doing contraceptive methods without sharing or not openly, they were limited to have access to those methods. So those are, in a nutshell, the core that I wanted to share to this question.
I mean, that's really great. I mean, you know, I think both you and Joan are really drawing attention to what Dr. Tedros calls the infodemic, right? We're not only dealing with the virus and all of the challenges to and the strain on the health system as well as the community, but we're also dealing with social media as not only sort of an enabler of good information, and I know you've done some really interesting work there on digital platforms in Mozambique, which we'll come to, Riaz, a little bit later. We're running a little bit behind, so I'm going to move us to what I'm going to call our rapid fire round. We're going to, I think we've seen a lot of questions that are underscoring some of what we've heard by way of introduction. And I want to use the next part of the conversation to drill down a little bit. One of the things that we heard, I think, loud and clear was the reductions in client volumes at health facilities. On the other hand, we're also seeing, like Riaz was saying, provider burnout, provider absenteeism, but we've also seen in many other countries where Pathfinder works that the frontline workers have been pulled into critical surveillance, testing and treatment tasks. So a question, Robert and Riaz, for you, from your vantage point at the country level, can you share one challenge you have faced in Uganda and Mozambique, respectively, in terms of delivering these services to women and girls? But I really want you to focus less on the challenge, perhaps, and a lot more on how you've addressed this. Robert, over to you. Robert, if you are speaking, you might be on mute. Right, we'll come back to Robert. Riaz?
Thank you, Reshma, once again. Well, first, I think the major challenge that we definitely saw in service provision was, sorry, there's an echo. Okay. So it was mostly on the lack of PPE at the health facility level for service provision. And that
sorry, Riaz, I think we're getting a lot of feedback. Everybody, participants, could you please check that you're on mute? Thank you.
Shall we try again? Okay.
Go ahead, Riaz.
Yeah, thank you, Reshma. So the major challenge that we saw in the service delivery was basically the PPE, the lack of PPE, and that was very much linked with the fear of providers to become ill and to getting the infection. And in order to really address this huge challenge, what we had to do was jointly with MOH, working very closely and redesigning a quick training package, embedding COVID-related messaging for different cadre of providers. And as Pathfinder, we worked very closely for sexual reproductive health component and the package for the maternal and child health nurses. And then with that, we had the second challenge because it was the cascading down these trainings, and we were coming for a completely new era where we had to really introduce the virtual world that hasn't been used as such in country, not either at national level or provincial or district level, but that was then the way that we started to really cascade it down. And this also brought different type of challenges as well, because at certain places we didn't have enough a good connectivity, but that was a critical training and a way to embed all the information on sexual reproductive health comprehensive counseling, definitely, but also using as a vehicle to reach all the clients and even providers with preventive messages for COVID-19. And definitely what we also saw with all that, there was some of, like, I'll say, losing some of the quality in the service provision, because the providers started to really become very overburdened. And then we also had in certain places, as in Maputo City, for example, we had some of the facilities having a high number of health providers getting infected.
Mm-hmm.
So that also included additional efforts for the ones that were working at that facility and creating more that fear and myths and misconception around the communities that are in those surrounding areas. So this was very, very challenging at the beginning.
Mm-hmm. Dr. Mutumba, welcome back. I'm glad. I hope your connection is working. Just to recap the question, you were talking to us about the impact, that you've seen in Uganda. Can you tell us one way in which you at the Ministry of Health, either through the task force or the pillars that have been set up, are doing things differently in delivering services to women and girls?
Yeah, thank you so much. One, the focus now has been on ensuring the rollout of the continuity of essential healthcare guidelines, and in issues of gender-based violence, but also services for adolescent health have also been integrated in the continuity of essential healthcare guidelines. But also the other most important aspect is the issue of information sharing. Yes, we also have pockets of communities that initially thought, but also maybe still think that COVID is a myth. So through this, we've been able to ensure that we employ a number of platforms. And most importantly, what's different now in Uganda is the issue of adopting, the president calls it a scientific approach, but this is largely using digital platforms. So we have now become more electronic and more virtual. I know that we've previously been of the analog, if I may use that. terminology. So we have really a number of platforms, and at the Ministry of Health where I work, so most of the interventions are now electronic. So we can now convene meetings via Zoom and be able to have a number of issues discussed. But the other thing I really wanted to highlight here is especially around the issue of teenage pregnancy, which I mentioned. We've had a policy dialogue on teenage pregnancy, and this was actually led by the Honorable Minister of State for Children and Youth Affairs. And as a result of this dialogue, we have a cabinet paper that was developed. And so the cabinet is really looking at this issue. And this paper is really aimed at seeing how best we can end pregnancy, again in line with the rest of the other existing frameworks. But also the other thing that is happening here is the issue around women empowerment. So there is a Uganda Women Empowerment.
Yeah, Robert has been having internet challenges. So I am going to keep us moving. I know we're all really interested in hearing about how the Ministry of Health in Uganda is addressing women's empowerment. But, oh, Robert, you're back.
Yes, I'm back. So this is really to ensure that the vulnerable women overcome this economic crisis due to the COVID-19 pandemic. And we also want to appreciate the support from the UN Women. They have really been at the center of ensuring that this support really comes through to ensure that the vulnerable women and girls are really able to have some socio-economic empowerment activities to overcome this. We also have, again, the GBV shelters to provide temporary accommodation for many of the GBV cases that I earlier mentioned. And through this shelter, women are counseled, especially those who've really, the victims of GBV. But I think most important also, what's different during this era is the fact that now Uganda has mobile courts. So the president okayed these courts.
Okay, I think we've lost Robert again. So I'm going to move us back, and we'll come back. I think mobile courts is definitely an innovation in this space. Annie, I want to move to you. The WHO has reported some numbing statistics as of yesterday. 38 million confirmed new cases of COVID around the world, over 1 million deaths. So clearly this pandemic is not going anywhere. When we talked last, we talked about the stories behind the statistics and what these stories symbolize in a way. At the What to Expect project, you've been doing some really creative and innovative work. I want to keep this conversation sort of forward focusing rather than just the issues and the challenges. Can you tell us some ways in which you've been able to deliver the program in the midst of what is looking like an out of control epidemic?
Sure. I love to be able to bring some of the underlying problems if I can, if time allows. You can just tell me at any point, stop. We've talked about that before, and I always welcome that. But for us, there's something really important that drives our work. And when we think about this, and especially because we have this community of moms of over 20 million, our work is really focused on the voices of moms. And that's what drives our programming, our advocacy, anything we ever do. It's not about what we're thinking or makes sense. It's really rooted at the community level, but certainly looking at science and making sure that science is not politicized and research isn't either. So that's an important component in light of recent things. But I just wanted to bring a couple of examples of things that will bring it to bear. And then I'll just lay out a couple other things and how we might be able to maneuver there. And you just stop me at any point, because we talked about that. But, you know, I think it's important for us, and it's something that I always do in our work. It's at the basic level of the work that we do, is that remembering the people. Behind every number, there's a person, and it's a family. It's a community, and we cannot disengage from that. And when we're having these conversations at a global level and at this level, I always like to bring that to bear, because for us, that's how we operate on a day-to-day basis. And for us during this pandemic, it really we've had to be very creative in thinking about, you know, we just have to translate our work into turning our attention to actually doing direct casework. And this is where sometimes, because of the connections that we have at every level, we're using them to be able to reach and bring services to the most vulnerable moms who reach out to us directly when they wouldn't feel comfortable to do that with their families. They don't feel there's a safe space. They feel with us that it's a non-judgmental space also, which drives our work, and it's supportive environment that they can actually feel and say what they're thinking. And it's the best way to be able to help them, because it's coming from a place of truthness and factual. So I'll mention two examples, for instance, you know, of real examples, you know, from some of the work. A mom complaining about chest pain and shortness of breath, and was told she was she had anxiety, and that she didn't need to come in to check in because it was impossible to get any appointment due to COVID. And this is when the fortunate moms that are able to actually be able to get this far, not the ones who we work with, you know, in many developing countries, but even in the US, this happens more than we all think about. Ultimately being diagnosed with an embolism, which you guys know, you know, it's caused by a blood clot. And after that, she suffered naturally from postpartum PTSD and debilitating anxiety. She wasn't even bonding with her mom. And we know even the important levels and what that means for children at the very early stages, from skin to skin, and be able to have that. Was prescribed some medication, and then referral that would take forever for her to ever get any help. And COVID, you know, and obviously COVID means stretch resources even for telehealth visits, which sometimes, you know, and that's even counting on people who have broadband, right? A lot of things that I'm kind of taking for granted sometimes. A baby born at the very beginning of the pandemic, but the mom wasn't allowed to see him in the NICU for 2 months. Actually, it was probably a little longer. Completely devastated, as we all can imagine as moms, crying all the time. First time she saw him, he didn't even know her. She was like a stranger to him. He was, the baby was weighed behind developmentally because of the isolated environment at the NICU without seeing her mother. The baby ended up having heart surgery, but she wasn't even, you know, told that she could even have access to the baby. So it's what that meant for that mom. And I think, you know, I'll raise this, and I hope that you will indulge me in making some of these comments, because in making these comments, they're translating into attention to, okay, what are the main issues that we need to address, and from there we've created a way to be able to do something about it, to address the needs of the moms. One of them. Lack of preparedness plans at the country level, you know, the health security threat, right? So without it, we know what we have. There's confusion over responsibilities. You need something as simple as supply chain organizational chart to the most complex and sophisticated pandemic readiness, delay in action, shortage of needed personal protective equipment that my colleagues have reached out, and I really want to emphasize because of the importance of women here. For health workers on the front line, most of them, as you all know, are women. Women comprise the majority of frontline health workers. Women health workers involved in pandemic response and mitigation have unique sexual and reproductive health needs. For instance, they may be concurrently pregnant, breastfeeding, menstruating. Women are also primary caregivers, and this means caring for relatives and also for children. Closures of schools have impacted their ability to work, causing additional financial hardships and psychosocial stress. I think some of us can relate to that even. And there's
I'm going to do the root thing of asking you to hold off a little bit, because I think what you're getting at is unique vulnerabilities, and I want to have a broader conversation on that. Yeah. But incredibly, I think an impassioned focus on something that even Benoit started talking about, women and girls-centered programming, and I think that's exactly what you're sort of drawing our attention to. The
and I'm
stories
going to go there later.
Behind. I want to shift us, right from that home and that front line and the story of the woman to sort of our supply chain, perhaps at the other end, because I think what's becoming evident is that we need all parts of the system to sort of work together for her. So I want to shift the conversation to Joan and Michael. And again, thanks for being patient, guys. Joan, I want to hear a little bit about, the HPV vaccine program that you were talking about. The importance of maintaining that routine immunization for girls, and what has Merck been doing creatively to keep that program going in the midst of all of the challenges that you talked about. And Michael, can you talk a little bit about Bayer's very bold commitment to support 100 million women in the developing world with contraceptives by 2030? I mean, indeed, very ambitious. What are some of the challenges you foresee in implementing this initiative in these times? What lessons have you already learned? But first to Joan.
Reshma, thank you for that question. I did say earlier on when I was setting the stage, I said HPV vaccination has not been exempt from the challenges, all of the challenges that we've been talking about, including supply chain. But before I get into what MSD has been doing, I wanted to pick up on something that Michael said earlier on about, collaborations, partnerships between the private sector, the ministries of health and other various stakeholders. Oftentimes people see the private sector, they see manufacturers as just the supplier of the product. But they don't, consider the fact that, it is in our best interest to ensure that our products are also being utilized and utilized appropriately, and that they are getting to people who need them. At the end of the day, what we want to do is make an impact, a public health impact in the lives of the people that, we are providing this vaccines to. And I think it was Annie who said, it's not about the numbers, it's about the people. And that's what's always front and center, of our minds when we think about, solutions. And I want to just, give you a quote, and it's a George Merck quote, which we all stand by that. And we say that we try never to forget about that medicine is for the people. It's not for the prophets. The prophets followed. And if we have remembered that, they have never failed to appear. And that's the driving force for us at MSD. Mm-hmm. So with respect to HPV vaccination, to ensure continued supply of our vaccines and that we continue to help save lives from these vaccine preventable diseases, our manufacturing plants have actually remained fully operational while ensuring the safety of our staff during COVID-19 pandemic. And I am really pleased to say that there have been no significant near-term impacts on production and supply of our vaccines, including HPV vaccines to date. However, and I said this earlier, as you know, supply is one thing. Delivering the vaccines with safe diplomatic approaches is quite another. We've heard from various speakers that many people are afraid of going into healthcare facilities for fear of contracting, COVID-19. And it's not an unreasonable, it's not an illogical fear. HPV vaccines are primarily given in schools and in developing countries and in clinics in developed countries. So with the school closures and lockdown, HPV vaccination programs have been either suspended or disrupted, resulting in decline in demand. So to help recover vaccination coverage rates, we as a company have been supporting some programs through innovative delivery ideas that include things like supporting for designing, providing support for designing community-based vaccination campaigns, awareness initiatives, exploring partnerships to deliver vaccines through alternative sites in ways that minimize contact. And I'm really excited about this one. I can't speak much about the details, but exploring ways to deliver vaccines through alternative sites that minimize contact and restores vaccine confidence in the communities. We heard earlier on about some of the things that are playing out in social media, the misinformation, the conspiracy theories. These things are affecting confidence in vaccines. And if they affect the confidence in vaccines, people are not going to show up to be vaccinated. Also, we're exploring how we might leverage digital and data systems to monitor cervical cancer screening, vaccine administration, and support catch-up immunization efforts. Because it's important, to be able to bring these women and girls back into the system post-COVID so that they can receive their vaccination. And even now, as things are winding down in some parts of the country and in some states, that people can be encouraged to come back into the healthcare facilities. There's actually one initiative that was done by one country where even though the schools are closed, they actually opened up some of the schools during the pandemic. Of course, maintaining safe distancing and the appropriate PPEs being worn by the healthcare providers, encouraging people to come with their masks. But they opened up the schools specifically to allow the girls to come in and get vaccinated. So the schools may have been closed for learning, but they could have been opened by many people in many places for vaccination. So I thought that was a brilliant idea and would love to see more of these kinds of, initiatives, coming up. We've got to think outside the box. Thank you.
Couldn't agree more. I mean, and a great use of existing space in ways that we can do it, provide essential services safely. Michael?
Yes, thank you. So the question was on the 100 million challenge. So again, the corporate vision, health for all, hunger for none, is embedded in our activities as a company and in our strategy. So we gave ourselves the 100 million challenge announced at the Nairobi conference, which was pre-COVID. So your question was, what are the challenges? I mean, having made an announcement pre-COVID to support 100 million, it becomes actually more challenging to keep on that during the COVID time. It is also, a challenge on production, product supply, also resources, as all companies are struggling with resources in COVID time and all organizations. So we are sticking to that commitment, and that commitment is embedded in our corporate remuneration system. So the managers of the company will be remunerated, and that's publicly available, that information, or it will be published since we are a stock listed company. So that is for the challenge in general. So we have been supporting family planning programs for 50 years now in about 130 countries. Is the broad range. Most of you know of the products. In the coming years, we are planning to expand, to address the challenge, to expand our offerings on long-acting reversible methods by 30%. That is on the supply side. But I also want to speak on this capacity building. So we are a commercial company. Maybe we have a peculiar view on capacity building. Each investment into capacity building should create lasting effects that remain sustainable and in place also once the investment has been concluded. And each project needs to enable systems and individuals on their journey to self-reliance. And we want to avoid creation of dependencies. That is what we have put into our textbook whenever we assess projects and we go into partnerships. Speaking about partnerships, we believe partnerships to address the 100 million challenge are crucial to achieve that goal. And we here, again, have a kind of key criteria for partnerships. We want to develop, strengthen systems, enable systems to self-reliance and supporting autonomy of systems and individuals long-term. So in that respect, we made this year, actually during COVID, I have to say, two announcements. One announcement was in July with UNFPA. And Benoit, you stated about the importance of capacity building and system strengthening. So the announcement was that UNFPA and Bayer recognized the importance of the intersection between humanitarian context, family planning, and maternal health. And we are joining forces to improve availability and quality of family planning products in key humanitarian settings. The aim is to strengthen the reaction systems in such settings, to make them more resilient long-term, and to scale up support for UNFPA in more systematically strengthening and management the use of pharmaceuticals in these humanitarian settings. And I mentioned before, like a commercial company can bring in much more on the table than products. So we had in another setting that is unrelated to this announcement we made in July with UNFPA together. So Maria Rosa was on the panel at DEVEX at that time. We had a discussion also with our partners where we collect globally information on road, truck, on airplane shipments, and on sea shipments. So into each continent, since we have commercial operations, we have knowledge, we have network. So this information is available to our partners upon request. So we share them openly with them to mitigate the impact on supply chain interruptions, especially during COVID time. So that is one example on supply chain partnership, one example on humanitarian setting partnership to address the 100 million challenge. And last but not least, I spoke about the urban slum settings. In August 2020, August this year, we have announced a major partnership with the Bill and Melinda Gates Institute at Johns Hopkins University to support that challenge initiative. I think some of the listeners on the panel, on the webcast here, they are familiar with that initiative. So TCI has a program in approximately 100 cities in informal settlements to support family planning. It's a platform to enable, and again here system strengthening and the criteria I mentioned, to enable governments to scale up high impact family planning approaches and sustain improvements in urban health systems. So our importance is here. So we want to have impact at scale, we want to have efficiency, and we want to have sustainability, and supporting that by an investment together with the Bill and Melinda Gates Foundation into the Johns Hopkins University Challenge Initiative program. So sum up, we will scale up production, we will support humanitarian settings in capacity building, we will support rural settings. This is an ongoing project in development now, and we will support urban poor settlements in family planning. And the examples I gave are only the beginning of a journey towards more projects. Thank you.
Thank you, Michael. And a really good reminder, you know, like you and Joan have been saying, that the private sector is not just a partner in terms of products, but a partner on many, many more things at many levels as well. Time has been flying, and I am going to change the last few questions that I'm going to ask you all to respect everybody else who has taken the time to join us online. We'll do an absolutely rapid fire round. Each of you has 30 seconds each. We are looking at the future. We have heard from each of you, you know, a range of innovative new partnerships, new models, new investments. We've also heard the challenges. If you had to look into the crystal ball and look towards the future, and you wanted a future where women and girls wanted to continue to have access to good services, what is the one thing that you would say we absolutely have to do? So we're looking into the future. We want to focus on women and girls. We want to mitigate the COVID-19 effects on women and girls, not only at the health system, as health providers in our communities. What is the one thing that you think we should be focusing on, or we will be focusing on going forward? I'm going to start with Riaz. Riaz?
Sorry, 30 seconds is hard for this question, but we'll try. I think it's a combination. Definitely, first of all, we have to be very capable in adapt, innovate, and implement, and continuously learning throughout the curve to ensure that we are able to meet the needs, but not assuming that we know what are the needs. With that, what I'm trying to say is definitely engaging the women, girls, youth, to have them designing and supporting what they really want as services to be provided to them. And this is very much tied to something that we all have to work and ensure, that is promoting voice and agency, empowerment. I think that's the key, so everyone can be really able to take and go for what they really need. Just to mention that when we are talking about vulnerable population, we have been talking about women, girls, but for example, just when the pandemic started, we also did a joint effort for Southern Africa to ensure that female sex workers, they could have access to and ensure their rights observed within this scenario of COVID-19, because HIV treatment, contraceptives, condom use and others like could be restricted and they could be victim of violence. So we have been also working on that, and just wanted to highlight that.
Thank you, Riaz. Joan?
So thank you. There's several things, but I'm going to limit it to this one thing, because this pandemic has taught us about the importance of real-time, high-quality data to address public health needs, and that could also help us in predicting future epidemics or pandemics. So for me, I would say that, you know, we certainly need greater investments in partnerships among data technology companies, vaccine manufacturers, and governments. And we need these kinds of collaboration, these kinds of investments early on to think through holistic solutions from development through delivery, such that data become an integral part of the program and not an afterthought, because that's what happens. We think about it later on, and then we're trying to retrofit things. So we at Merck welcome these kinds of partnerships with governments and technology companies on this front, advocating for data infrastructure sooner rather than later. Because these will help us in identifying where those vulnerable populations are, you know, where resources need to be redirected to actually target the problem much more, you know, better than we are currently doing right now. So I'm going to end by saying that as the world continues to find solutions for COVID-19 pandemic, many continue to die from vaccine preventable diseases for which we have proven solutions and vaccines. You know, for every one excess COVID-19 death attributable to SARS-CoV-2 infection acquired during routine vaccination clinic visits, the research showed that there could be 82 deaths in children prevented by sustaining routine childhood immunization in Africa. So I end by saying, let us remember to use existing vaccines and not lose the immunization gains we have made over the past several decades. Thank you.
Excellent. Thank you. Joan, Annie, 30 seconds.
Okay, it's going to be tough because I didn't address some of the issues from the previous question. So I'm going to say the top level, you know, I guess headlines. So the number one, healthcare is already not what it should be. It needs to be centered on people. Women and girls must be the priority, and they must be represented at all levels of decision making. We need to address issues of realistic expectations on the ground. It has to be women-led, addressing misinformation, resiliency and adaptability, disrespectful maternity care are issues that need to be addressed, structural racism that we haven't gotten into that are so critical, partnerships that have been mentioned by my colleagues across the sectors, equitable coordination across the level. Social media was addressed. It's also a really powerful tool in many, many, many countries, and we're seeing that as a way, especially on very vulnerable issues like gender-based violence, where women are feeling even more comfortable being able to speak through those platforms. I cannot leave behind issues of having women in leadership positions, the sustainability of programs, avoiding politicization of science. Your voice matters, and this is where advocacy, as an advocate, I have to talk about these. Your voice matters, your vote matters. Look at grassroots advocacy. Advocacy campaigns are so powerful. We cannot go back after the progress we've made. From the ground up, this pandemic has a woman's face, and amplifying women's voices is an ongoing battle. We need to look at mobilization to make change, real change. We're sidling back, we're not moving forward. Comprehensive, responsive, quality, respectful care, and continuum of care throughout the life. And I am going to end with a quote from Dr. Muhammad Fatala, who I'm not pronouncing his name correctly, but I admire him so much as a champion of safe motherhood. Women are not dying of diseases we cannot treat. They're dying because societies have yet to make the decision that their lives are worth saving.
Excellent. Oh, absolutely. Michael, you're going to have to follow that one.
So I have 15 seconds now. Yeah, okay. Stop segregation. We need to work together. Use the complementarity, join forces of diverse expertise and know-how. And maybe a statement here, I say that quite often, knowledge is a resource, and knowledge is a resource which is getting better the more you use it, and not being used up as other resources. So we should join forces together. There is not the greedy commercial company and the good NGO in the world. We all have the same goal here. And even, we and the colleague from Merck on the phone, we are not competitors. We are part of the system in a market, which is not a market where you have more demand than supply. We have to solve a problem together. And that is a mindset we should build on if we want to change the world.
Wise words, Michael. Thank you. Robert, you get the last 30 seconds. What is the one thing that we should be focusing on going forward?
Yeah, thank you so much. And that one thing is the multi-sectoral collaboration. So the different ministries, departments and agencies and IPs should be able to work together, but also ensuring that we integrate programs, but most especially increasing access. Women and girls should be able to have access to the healthcare services that they need. And I think in my last second is the issue of coming up with the innovative approaches to ensure that we are able to use or come up with local solutions to address the local challenges. Thank you.
Mm-hmm. Thank you. Thank you all. I hope, I know I haven't done sort of my primary job of timekeeping, but I hope you'll agree it's been a fascinating conversation, some great perspectives, a lot of wisdom from all the three sectors, and pointing towards why we need to work together in these times. I now have the pleasure of handing over the session to the always inspiring Lois Pace. Ms. Pace is the President and CEO of the Global Health Council. She has worked in more than 15 countries, delivering health programs and mobilizing advocates. She comes to this role having held strong leadership positions in global policy and strategic partnerships at the Livestrong Foundation, American Cancer Society, Physicians for Human Rights, and Catholic Relief Services. But before I do want to say to the panelists and the speakers, thank you for your perspective and for your commitment, your dedication, your passion, your impatience. We have so much more work to do together so that women and girls can share the burden, perhaps, of holding up that sky. To the organizers at Pathfinder, the Global Health Council, the What to Expect Project, thank you for your energy and enthusiasm. I think it's a much needed conversation, and this will hopefully be the fuel for action. To our online audience that has stayed with us over time, I want to say thank you for choosing to spend your time with us. I hope you go into this weekend inspired by the collective passion and impatience of this group to do more, to do better. We have a lot to do for and with women and girls so that the progress we have made is not erased by COVID-19. Stay safe, stay healthy, stay impatient, and to quote an American hero, the great Senator John Lewis, continue to get into good trouble. Over to you, Lois.
Oh, I love that, Reshma. You really got me with John Lewis there. Thank you. Thank you for leading such an inspiring panel and discussion. And thank you again to each of our panelists for offering such incredible insight for everyone today. And as Reshma said, I'm Lois. I head up the Global Health Council, and I have the honor of closing us out today. I will also try to follow suit and keep my remarks rather brief, but as I take away some things from today, I thought I would first start by thanking our co-hosts at Pathfinder and What to Expect project. Annie and Crystal in particular are gems in this space, and I'm incredibly grateful for their partnership as well as being able to collaborate with their colleagues and friends. So my regards to them. I also am really struck by Reshma's challenge that we really consider this sort of passion and impatience in this space. And speaking of inspiration going into a weekend, last weekend, NPR, an outlet here in the US, published what I thought was a lovely photo essay featuring women and their experiences with COVID. And it really demonstrated the spectrum of a woman's experience, right? And everything that you all raised today, which is there, first off, is a spectrum of disease or things they're at risk for, or things they're just faced with, right? Whether that's sort of economic stability, whether that's a health issue, and even within the health space, you all have talked today about everything from maternal or newborn health to sexual and reproductive health, as well as cancer and gender-based violence. And so I'm keeping that, you know, the richness of a woman's experience in mind. Even beyond, though, sort of what a woman is facing or holding up, there's this spectrum of sort of what we do and what we champion as women in this space, whether that's access to services, as you all have mentioned, or providing those services or that care at a community level or a clinical level. And so this sort of story or photo essay I'm referencing really touched on that. And I heard all of that again today, even more in depth. You all helped me paint an even fuller picture of a woman's experience during this incredible time. And so I want to acknowledge that, and I hope that others are feeling that's something they can strongly take away as well. It even goes beyond, though, a woman's experience, however we define that. And that's something else that stood out to me quite strongly, is that there is a vulnerable behind the vulnerable, if that makes sense. And so there are communities of women that are even further marginalized or harder to reach, if by no fault of their own, I should add, right? And so whether that's Indigenous women or women in rural communities, whether that's sex workers, as was mentioned in the tail end of the comments as well, whether that's women in extremely impoverished situations, or just otherwise at risk in terms of their safety, in terms of their stability. It's the layers, again, keep coming up as a theme for me, the layered experience, and thus the necessarily layered response that we need. And so that leads me into a few sort of solutions-oriented takeaways. I think it was Joan who really sort of emphasized the importance of bringing all people together and everyone to the table when it comes to addressing the needs on the ground. You know, the problems are so vast, and we're already so vast even in advance of COVID. And so, especially in a pandemic, we don't have the luxury of leaving anyone behind, and that includes the people who can be helpful. And so it's really been heartening to both see and hear the richness of all of the players and stakeholders who are about providing those solutions. Another takeaway for me as part of that discussion and the theme of bringing everyone together is how creative we truly need to be and how innovative we need to be. And sure, that involves products and technology, but even sort of just thinking differently about how care or services are delivered. And I applaud each of you for being a part of those innovative solutions, but even those from whom we didn't hear today, right? People who are tuning in and who, again, are living and breathing in this new world order. I'm sure that you all can relate to this plea for innovation and creativity. But finally, and possibly most importantly, is this emphasis on leadership. And whether that comes from the country or community level, ensuring that it's women who are leading. Let women lead. We know, they know what to do. And so we need to allow them to do that. I mean, most often, these solutions for special populations and certain groups come from those groups themselves, right? That the best answer to the problems is going to come from that community. It's the most basic adage that we have, and yet I think those of us in this space still see some ways that we struggle to fulfill that promise. And so I am grateful that, that again, this event, I think, demonstrates the importance of women's leadership. And I would like to applaud and thank again each of you for offering what you have for each of us today. And with that, I wish everyone well.
Thank you.